Uplift Family Services helps the most vulnerable children and families in the Metro and South Los Angeles communities from our offices in Hollywood and Lynwood. As we celebrate the enormous and important contributions of Black Americans this month, we remember that while we have made significant strides, structural racism and inequality are still pervasive in our society and must be dismantled before we can call ourselves a more just and perfect union. Compared to the rest of the US population, BIPOC demonstrates high rates of substance use disorders, post-traumatic stress disorder, and suicide. And Black children are largely overrepresented in foster care and institutional and group care. There is still much work to be done, and today we will briefly summarize a range of Uplift Family Services aimed at offering hope and healing. Hollygrove is privately funded. Through our generous donors and grants obtained, Hollygrove offers services free of cost to support wellness in our community. Hollygrove offers Hollygrove Haven, a virtual program for elementary school-age children and their families to receive support in navigating online learning, managing difficult behaviors that impact learning, offer one-on-one homework help, academic groups, and social-emotional groups. Parent Institute is a virtual program that provides a space for English and Spanish-speaking parents to learn new skills, support one another, and grow their social network. Parents learn the importance of modeling, how to inspire children, and how to create teachable moments during everyday life. For more information about Hollygrove Haven or Parent Institute, please contact us at 323-543-5660 or by email at hollygroveservices@upliftfs.org.
Outpatient mental health services are clinic-based and community-based treatment services using evidence-based practices. Like our outpatient services, our school-based services provide early intervention and therapy to children, adolescents, and families who are suffering from a mental health issue. We truly value the partnerships that we have created with our schools. During these difficult times, amid the struggles of distance learning, we continue to be part of the school environment, their assemblies, their social media, and their parent meetings. We also facilitate monthly parent workshops and have covered a variety of topics from how to set up study areas in the home to how to cope with the pandemic to our most recent one about grief and loss. We provide a safe space for parents to learn about mental health and how to get connected with services.
Offered out of both our Hollywood and Lynwood sites, Wraparound is designed for high-risk children and adolescents with the most complex needs. Partnering with DCFS and probation, these services aim to keep children and their families together through individualized services developed in a family-centered team planning process. Services are provided at home and in the community. Wraparound provides services that are sensitive to the special and unique needs of each and every family we serve. We work with children and families to develop relationships that are therapeutic and healing in order to reduce the negative impact of experiences that may have been traumatic, racist, or abusive. Wraparound attends to the whole person, to more than just mental health, to include factors that support and impact mental health, such as basic needs, educational needs, legal, recreational, and social needs. We do this by suspending our own belief systems, making every effort to listen to our families, to understand each child and family's values and beliefs, to see the world from the child's and family's perspective, and to provide the services that the child and family identifies as necessary.
From our Lynwood office, we provide a more intensive level of care. The Intensive Field Capable Clinical Services IFCCS program serves children and transitional aged youth up to 21 years old with an open DCFS case who have had difficulties maintaining a stable placement. Services include individual and family therapy, vocational and educational referrals, case management, trauma-informed services, and linkage to community resources. The goal of Full Service Partnership, FSP, is to stabilize high-risk children ages 0 to 15 and their families and provide them with whatever treatment, service, or resources they need to stay at home, recover from mental health illness, remove barriers that prevent them from achieving healthy levels of functioning. Like our sister agencies, we've made the pivot to provide mental health services through telehealth and have become skilled at outreach, caregiver and family engagement, assessment, treatment planning, and evidence-based interventions. We continue to work to bridge the digital divide by providing case management services in order to link our families to the resources they need to participate in their treatment.
Oftentimes, when faced with challenging or troubling situations, our communities of color or BIPOC seek support within their family unit, their friends, and/or their church communities, historically rejecting the structured organizational systems due to feelings of anger, fear, mistrust, experienced injustices, or unfairness. In turn, mental health services can be viewed negatively or as an indicator of something being wrong with me, my kids, my family, breeding the stigma and misinformation. This thinking discourages accessing care, asking for help. This thinking contributes to generational cycles of poverty, of limited or inadequate educational, medical, and housing opportunities, of substance misuse, and legal system involvement. At Uplift, we humbly aspire to support in disrupting such cycles. For more information or to make a referral, contact Veronica Alanez, our intake coordinator at 323-769-7171 or 323-793-3988. Uplift Services is here for you.